Can I ask you a question that most people never think to ask? What if the pills you're taking, are you quietly slowing down your brain? You're doing everything right, eating better, taking your vitamins, following the doctor's orders, but you still feel off, foggy, more forgetful than usual. And deep down, something doesn't feel right. Most people think memory loss just comes with age. But sometimes it's coming from inside the medicine cabinet. You see, there's a group of medications called anticholinergic drugs. And they're everywhere in allergy meds, sleep aids, bladder pills, even some antidepressants. They're so common, so normal, we never question them. But study after study from Harvard Health Publishing, the National Institute on Aging, and even the Journal of the American Medical Association has shown that these drugs can slow thinking, increase confusion, and even raise the risk of dementia in older adults. And the worst part, most people have no idea they're taking them. Have you ever felt more forgetful after starting a new medication? If yes, type 1 in the comments. If not, type 0 just so I know you're here. In this video, I'll walk you through 7 common brain-slowing drugs that every older adult and every caregiver should know about. Because the truth is, you deserve to know what's affecting your brain. Let's start this journey together and protect the mind before it fades. Number 1, what are anticholinergic drugs and why they matter? Let's slow down for a moment and talk about a word that sounds complicated but affects millions of brains every single day. Anticholinergic. What does it mean? It refers to a class of medications that block acetylcholine, a chemical messenger your brain needs to think, remember, and focus. Acetylcholine is like oil in an engine. It helps your neurons communicate, send signals, and stay sharp. But anticholinergic drugs put a roadblock in that system. They interrupt the message. They slow the engine down. And if you're over 60, your brain already produces less acetylcholine naturally. So when you add one of these medications, you're doubling the impact. Here's the twist. These drugs were never meant to harm the brain. They were designed to calm overactive nerves, to stop bladder spasms, ease allergies, reduce nausea, help with sleep. They work, yes, but they work by suppressing the brain's communication system. And the longer you take them, the more likely you are to experience slowed thinking, memory fog, trouble concentrating, increased risk of falls, confusion, or even delirium. According to Harvard Medical School, older adults who regularly take strong anticholinergics may have a significantly higher risk of developing dementia, especially if used long term. And yet, millions of these prescriptions are filled every year. Have you ever seen the word anticholinergic on a prescription label? Type yes if you've heard of it, or no if it's new to you. Let's see how many of us are learning this for the first time. So, what kinds of medications are we talking about? We're not just talking about heavy-duty drugs. We're talking about everyday pills like allergy tablets, nighttime sleep aids, bladder control meds, and certain antidepressants. They look harmless. But when combined or taken for years, they can quietly drain your cognitive battery. In the next few minutes, I'll walk you through 7 of the most common ones. Some of them might be in your medicine cabinet right now, but don't panic. You don't need to stop them today. What you need is knowledge. In a good conversation with your doctor, at Dr. Brain, we believe that clarity begins with curiosity. And today, you're asking the right questions. Let's move forward. Number 2, why older adults are more vulnerable to these drugs. You might wonder if these medications are everywhere. Why are they especially risky for older adults? It's a good question, and it begins with biology. As we age, the brain naturally produces less acetylcholine, the key neurotransmitter responsible for memory, learning, and focus. That decline doesn't mean something is wrong, it's part of the aging process. But when a medication blocks acetylcholine, even slightly, where that natural decline becomes more serious, where they say it's like taking a battery that's already running low and draining it faster. The result, cognitive slowdown, increased brain fog, and a higher risk of confusion, falls, and memory problems. But that's not all. Older adults also tend to have slower liver and kidney function, which means medications stay in the body longer. So a pill that wears off in a younger person's system overnight might linger much longer in a senior's bloodstream. This prolonged exposure increases the cumulative impact, especially for drugs that affect the brain. Additionally, older adults often take multiple medications. This increases the chance of drug interactions and makes it harder to track which one might be causing cognitive issues. According to research published by the Journal of the American Medical Association, JAMA, seniors who regularly use strong anticholinergic drugs are at a significantly higher risk of developing dementia, especially when those medications are taken long term. And in many cases, neither the patient nor the doctor connects those subtle symptoms back to the drug. Have you or someone you love ever taken more than 3 daily medications? Type yes in the comments. If so, or still learning if you're just becoming aware of this risk, understanding this vulnerability isn't about blaming anyone. It's about seeing the full picture and giving our brains the best possible chance to stay sharp. Because when you're over 60, even small changes in brain chemistry can have big effects. And when it comes to protecting memory, being informed is the most powerful medicine we have. Let's keep going. Drug number 1, diphenhydramine, Benadryl, and OTC sleep aids. Let's begin with one of the most common and most underestimated medications used by older adults. Diphenhydramine. You might recognize it by a more familiar name, Benadryl. It's in your allergy medicine, your cold medicine, even in your PM sleep aids like Tylenol PM or Advil PM. But what many people don't know is that diphenhydramine is a strong anticholinergic. It works by blocking histamine, but it also blocks acetylcholine in the brain. And that's where the problem begins. In older adults, blocking acetylcholine can cause confusion, slower thinking, drowsiness, memory problems, increased risk of falls, according to Harvard Health Publishing. Diphenhydramine has been consistently linked to cognitive decline in seniors, especially when used regularly or over a long period. It might help you sleep, but it does so by sedating your brain, not by improving sleep quality. And here's the catch. Because it's available over the counter, people assume it's safe to take daily, but that's a dangerous assumption, especially if you're over 60. Have you ever taken Benadryl to help you sleep or used a PM pill to get through the night? Type yes in the comments if you have, or no if you avoid those. Now, let me be clear, diphenhydramine has its uses. It can be helpful in short-term allergic reactions or emergencies. But for sleep, for nightly use, it's not recommended for older adults. There are safer options like melatonin, lifestyle sleep routines, or doctor-guided alternatives. If you're currently using Benadryl or a similar product to sleep, talk to your doctor. Ask, is this medication anticholinergic? Is there a safer option for someone my age? And if you're a caregiver, check the label. Watch for diphenhydramine in any nighttime or PM medications. Because sometimes the quietest pill on your nightstand can be the loudest threat to your memory. At Dr. Brain, we always say sleep should restore your brain, not suppress it. Let's look at what's next. Drug number 2, oxybutynin overactive bladder treatment. Let's talk about a medication that seems harmless but can quietly interfere with how the brain functions. Oxybutynin, it's often prescribed for overactive bladder, a condition that affects millions of older adults. You may know it by brand names like Ditropan or Oxytrol. Oxybutynin works by calming the bladder muscles, but it does so by blocking acetylcholine, the same chemical your brain depends on for clear thinking, memory, and focus. And that's where the trouble begins. According to the National Institute on Aging, medications like oxybutynin can cross the blood-brain barrier and reduce cholinergic activity in the brain. This can lead to slowed processing, memory lapses, difficulty concentrating, mental fog, daytime drowsiness, increased risk of dementia over time. What's especially concerning is that oxybutynin is still one of the most commonly prescribed drugs for older women dealing with urinary urgency or incontinence despite its strong anticholinergic effect. And many people take it for years without being told of its cognitive impact. Have you or someone you care for ever used a bladder medication like this? If yes, type yes in the comments. If you're not sure, type not sure. And check your prescription label later. There are safer alternatives available today. Options like Mirabegron, Mirbatrik have been shown to have less impact on brain function. Lifestyle changes and pelvic floor therapy can also reduce symptoms. But here's the most important thing. You should never stop a prescription suddenly. Instead, have a thoughtful conversation with your doctor. Ask, is this medication safe for my brain? Are there non-anticholinergic options I can try? Because what's meant to calm the bladder shouldn't cloud the mind. At Dr. Brain, we always say, if it affects your memory, it deserves your full attention. Let's move on to drug number 3. Drug number 3, tricyclic antidepressants and first-generation antihistamines. Now let's look at 2 groups of medications that many people have been using for decades without realizing what they might be doing to the brain. First, tricyclic antidepressants, or TCAs for short. You might recognize names like amitriptyline, nortriptyline, or doxepin. They were widely prescribed in the past for depression, anxiety, chronic pain, and even insomnia. Second, first-generation antihistamines, including chlorpheniramine, hydroxyzine, and diphenhydramine, which we discussed earlier. They're found in cold medicines, allergy tablets, and sleep aids. So what's the issue? Both groups share one thing in common. They are strong anticholinergic agents. They block acetylcholine, the very chemical your brain needs to stay alert, focused, and sharp. And when used regularly, especially by older adults, they can lead to memory fog, difficulty, concentrating, confusion, daytime drowsiness, increased risk of dementia. According to Harvard Medical School, long-term use of TCAs, or first-generation antihistamines, has been associated with a significantly higher risk of cognitive decline, particularly in people over 65. And here's the hidden danger. Some of these drugs are still being prescribed today, not for depression or allergies, but for things like chronic back pain, nerve pain, or trouble sleeping. So, a drug originally meant to manage mood might now be impacting memory without anyone realizing it. Have you ever been prescribed amitriptyline, doxepin, or a sedating allergy pill like chlorpheniramine? Type yes in the comments if any of these sound familiar. If you're not sure, type I'll check my labels. So, what should you do? First, don't panic. If you're on one of these medications, just talk to your doctor. Ask, is this drug affecting my memory? Is there a safer alternative now available? There are newer antidepressants and antihistamines that don't carry the same anticholinergic burden. Remember, these drugs were developed long before we understood just how sensitive the aging brain is to acetylcholine suppression. At Dr. Brain, we always say, medicine should help you feel better, not forget who you are. Let's continue. Drug number 4, GI antispasmodics and muscle relaxants. Let's talk about two more groups of medications that often go unnoticed yet quietly interfere with how the aging brain functions. First, gastrointestinal antispasmodics, like dicyclomine or hyoscyamine. These are used to treat stomach cramps, irritable bowel syndrome, and digestive discomfort. Second, muscle relaxants, such as cyclobenzaprine or methocarbamol, commonly prescribed for back pain, stiffness, or post-surgery recovery. Now, here's what they have in common. Both groups are potent anticholinergic drugs. They work by calming spasms in the body, but they also block acetylcholine in the brain, which can lead to mental fog, slowed thinking, disorientation, increased fall risk, memory problems. According to the American Geriatric Society's Beers criteria, these medications are considered high risk for older adults not because they're bad for everyone, but because the aging brain processes them differently. And the effects are often mistaken for just getting older. Someone might feel groggy, dizzy, or confused, but never suspect that a muscle relaxant or gut medication could be the reason. What makes these drugs particularly risky is that they're often prescribed short term, but taken long term. And unlike some other medications, they can cause cognitive side effects even after a few doses. Have you ever been prescribed a muscle relaxant or medication for stomach cramps? Type yes in the comments if so. If you're not sure, write check-in soon. So what should you do if you or someone you love is taking one of these medications? Ask your doctor, is this medication anticholinergic? Is there a safer alternative for someone over 60? Sometimes non-drug options like stretching, heat therapy, or dietary changes can help relieve symptoms without affecting brain function. And remember, what calms the body shouldn't confuse the mind. At Dr. Brain, we always remind our patients relief is good, but clarity is better. Let's continue. What to do if you're taking one of these drugs? By now, you might be wondering, what if I'm already taking one of these medications? First, take a deep breath. This is not a call to panic. It's a call to pay attention. These medications were prescribed for a reason: pain relief, sleep, bladder control, digestive comfort, and many times they helped. So, this is not about shame, it's about clarity. The goal here isn't to scare you, it's to empower you with knowledge so you can make informed decisions moving forward. So, here's what I recommend. Step 1, make a medication list. Write down everything you're currently taking prescription, over the counter, supplements, and even nighttime aids. Many anticholinergic drugs are hidden in PM formulas, allergy pills, or combination products. So double check the ingredients. Step 2. Ask your doctor or pharmacist this question. Is any of this considered anticholinergic? They may use a tool called the Anticholinergic Cognitive Burden Scale to assess how much impact your medications might be having on your brain. Step 3. Never stop taking medication on your own. Some of these drugs need to be tapered slowly, especially if they affect your mood, sleep, or bladder function. Instead, ask, are there safer alternatives? Can we try a lower dose? Would lifestyle changes work better for me at this stage? According to Mayo Clinic and NIH, replacing or reducing high-burden anticholinergic drugs can lead to improved alertness, reduced confusion, and even better sleep quality within weeks. It's never too late to reassess. Have you ever reviewed your full medication list with your doctors, specifically asking about brain impact? Type yes if you have. If not, type I will. And let this be your next step. Because the medications we take every day shouldn't quietly undo everything we're trying to protect. At Dr. Brain, we believe that your brain deserves a seat at the table every time a new prescription is written. Let's keep learning. Why these drugs are still prescribed and what that means. By now, you might be wondering if these medications are risky for the brain. Why are they still being prescribed? That's a fair and important question. The answer is layered. First, many of these drugs have been around for decades, and they were developed long before we fully understood how aging brains process medications differently. Back then, the focus was on symptom relief, not long-term brain impact. Second, some healthcare providers may not be fully aware of how strong the anticholinergic effect truly is unless they work specifically with older adults. They may not be trained in geriatric pharmacology, a field that considers how medications affect the aging body and brain. Third, time is limited. Most medical appointments last fewer than 15 minutes, and doctors may focus on the most urgent complaint like sleep problems or bladder issues without having time to review all long-term risks. And finally, patients don't always report cognitive side effects. If someone feels foggy or forgetful, they might blame age, not the medication. So what does this mean for you? It means you have an important role to play. Have you ever felt hesitant to question a prescription your doctor gave you? Type yes in the comments if so. Or not yet if you haven't, but want to learn how. Because here's the truth. Advocating for your brain health is not difficult. It's being responsible. At Dr. Brain, we often remind our patients doctors want to help, but they need your feedback to do it well. So speak up. Ask questions like, does this affect memory? Is there a newer alternative? Could this interact with my other medications? When you ask with respect and curiosity, you're not just protecting your brain, you're helping your doctor become a better partner in your care. This is how real change begins, not just with better drugs, but with better conversations. Let's close with one final message. If you've made it this far, then you've done something powerful today. You didn't turn away from the hard truth. You didn't ignore the quiet risks. You listened with courage, curiosity, and care. That's how we protect the people we love. And that's how we protect ourselves too. Because when it comes to memory loss, we often think of it as something we can't control. But today, you've learned some parts we can. By asking better questions, by reading our labels, by partnering with our doctors. If this video opened your eyes, type "I choose clarity" in the comments. It lets me know you're not just watching. You're waking up to protect your mind. At Dr. Brain, we don't believe in fear. We believe in gentle awareness, in knowing just enough to take the next smart step. And speaking of next steps, did you know that some medications prescribed for high blood pressure can also affect memory, fatigue, and dizziness in older adults? In our next video, we'll explore 6 simple but powerful steps to improve blood pressure treatment after age 60 with less confusion, fewer side effects, and a lot more confidence. Because your heart and your brain, they work together. And treating one should never damage the other. So if you care about brain clarity and heart health, make sure to click below. And don't forget to subscribe, because your next smart decision could start with the next video. Stay kind to your brain. It's been working hard for you. Let's take care of it together.